Thanks to the efforts and vision of a handful of volunteers who provided end-of-life care to 7 patients our first year, the seeds of hospice and palliative care took root in Charleston and blossomed into the invaluable community healthcare agency we have today. HospiceCare now employs hundreds of experienced and specially trained professionals and volunteers who provide quality health care to thousands of terminally ill patients and their families each year throughout Central West Virginia. For more than 35 years, HospiceCare has led the way in developing a variety of hospice and other support programs designed to help as many people as possible. As part of our community outreach, we encourage patients and their families to enter the program as soon as possible in order to receive the maximum benefit of all of our services. This gives us the opportunity to truly help the patients with comfort issues and assist the families as they care for their loved one. We often hear from our patients and families that they wish they would have called us sooner. Despite complex healthcare issues we face these days, HospiceCare continues its tradition of putting its patients and families first, meeting them where they are, not where we would like them to be. Our primary focus of care for our patients is in their home, be it a house, apartment, mobile home, nursing home, or assisted living facility. For those patients who have a special need or require additional support, HospiceCare proudly offers 3 fully staffed inpatient facilities that provide expert care with all of the comforts of home. The Hubbard Hospice House in Charleston, Hubbard Hospice House West at Thomas Memorial Hospital in South Charleston, and the Peyton Hospice House in Lewisburg were all designed with our families in mind to help them feel right at home while receiving care.
Many people want to know, when is it time to call hospice for help? When a person faces a progressive terminal illness or incurable disease, there comes a time when life-prolonging therapies and repeated hospital stays become overly burdensome. At that time, what patients often want most of all is a chance to be at home with family and friends, with their symptoms under control, but always with the assurance that prompt professional help is available at any time. When this kind of care becomes the goal of the patient, then it's a good time to discuss hospice care with the physician. All too often, hospice referrals are made so late that a person misses their last chance for meaningful time at home with their loved ones.
Our hospice nurses serve as case managers to their patient and coordinate care with other team members. We visit during the week to assess the needs of the patient and their caregivers. That way we can address any problems that manage their symptoms and, most importantly, monitor and control their pain. We are the eyes and ears of the physician, allowing us to treat the patient's needs according to their care plan. We also have nurses on call in case of emergencies, so there's always someone to provide support 24 hours a day, 7 days a week, including the holidays.
The hospice social worker goes into the home or nursing home and provides emotional and social support to the patient and the family. An illness has a traumatic effect on the patient and their family members, and the social worker is there in a very unique role to ease the emotional pain. We allow patients to voice their feelings and to help them develop coping skills. Another role of the social worker is to help with financial issues. Oftentimes, patients and their families are overwhelmed with medical expenses. We can resolve some of those financial issues, which decreases the stress on the patient, caregiver, and family. Also, a social worker can be a link between hospice and various community services.
If it wasn't for hospice, I don't think we could get along. She'd have to go to a nursing home because I couldn't handle all of it. They're just like I told them, they're the angels that's always come in, don't even have to go to heaven to get them. They're over here anytime we need them.
I'm very grateful to be a hospice volunteer. Hospice care was originally started by a group of dedicated volunteers in 1979, and that tradition is part of who we are today. Volunteers play a vital role in the organization, and being of service is very rewarding. A volunteer can help in many ways, from working directly with patients and families in their home to running errands or helping at one of our hospice houses. Many volunteers help in the office with mailings, filing, or special projects. We also have a dedicated volunteer music program that coordinates singing groups and musicians to perform at our inpatient facilities and other venues. Volunteers are an invaluable part of the hospice care team. If a family needs a volunteer, we're here to help.
HospiceCare is pleased to offer expanded grief and loss services to our community through the Wallace Grief Support and Education Center. The Wallace Center provides high quality and affordable bereavement services for the whole community. Grief support is offered individually and in a group setting for adults, children, and teens. The Wallace Center provides a safe space to allow your healing journey to begin. In addition to grief support and education for those experiencing a traditional loss, the Wallace Center offers expanded services to those dealing with a disenfranchised loss as a result of suicide or homicide, miscarriage, infant stillborn, and even the loss of a family pet. Bereavement counselors are also available to come to your place of business or school to provide grief support and education. Also, as part of HospiceCare's Kids Path program, the Wallace Center offers Camp Mend to Heart, a one-day summer camp that gives children and teens ages 5 to 15 years old a safe place to learn about their grief journey and receive peer validation, all while having a little summertime fun.
When caring for loved ones becomes too difficult at home, or families need a break from providing care, HospiceCare can help. Hubbard Hospice House in Charleston, Hubbard Hospice House West in South Charleston, and Peyton House in Lewisburg offer round-the-clock care and support for hospice patients and their families needing acute or respite care. Our hospice houses offer spacious private bedrooms with attached bathrooms, comfortable living rooms, and quiet setting areas, as well as relaxing family rooms with TVs, computers, and other games. We also have rooms equipped to meet the needs of children and their families. Each house was designed to serve as a home away from home for our patients and their families. We are fully staffed by doctors, nurses, and certified nursing assistants to help patients feel safe and secure while receiving more intensive care.
For people who have been diagnosed with a serious illness but are not eligible to receive hospice services, the Palliative Care Center is here to help. Palliative care is a board-certified specialty that takes a holistic approach to patient care and support, addressing the physical, emotional, social, and spiritual needs of the patient and the caregiver. We help them to manage symptoms and feel the best they can to live well in spite of the illness. The Palliative Care Center provides education and consulting to help our clients, often when they have no other support available. Our education is for caregivers through workshops and support groups. Nationally, palliative care programs are making a difference for patients and their loved ones, and HospiceCare is proud to bring that option to the people of West Virginia. Over and over, we've seen good outcomes. Pain is relieved, anxiety and depression are eased, insomnia, nausea, and weakness are all addressed. Caregiver stress is reduced with support and other appropriate solutions. Often, hospital and emergency room visits are avoided with this extra layer of support. Anyone with a serious illness such as cancer, dementia, lung disease, heart disease, or neuromuscular disease qualify for palliative care, as well as the frail elderly.
Long-term care facility is a general term used for nursing homes or assisted living facilities. They provide residential support or custodial care for people living with a serious illness or age-related debility who require end-of-life care. HospiceCare provides hospice and palliative care services to these residents when it is apparent that time is limited and the focus of care needs to be on comfort while maximizing the patient and family's quality of life. The facility staff and our long-term care team each contribute their own special expertise to ease pain and suffering associated with the illness. The nursing home or assisted living facility assures 24-hour care in a safe, comfortable, and caring environment, while the hospice care provides expertise in pain control and symptom management of end-stage diseases.
When we walked in these doors, It was just like walking into our own home. How it helped me was it let me have quality time with my loved one the last 6 days, to where I didn't have to worry about taking care of her. But I was able to be here with her. And she asked me, she said, whenever she come over, she said, will you stay there with me? And I promised her I wouldn't leave her. What really, really impresses me about the hospice house and Hubbard is the quality of care. And they want you to be here with the patient so you can have that quality time with them while they help you grieve the passing of a loved one.